We know because antidepressants really change the balance of neurotransmitters that in and of itself impacts sexual function. And what we typically see is low sexual arousal or difficulty with sexual arousal, difficulty or low sexual desire, and then difficulty achieving orgasm. So desire, arousal, orgasm, those are the three main things that antidepressants can impact. Tell your prescribing provider. A lot of women, and men for that matter, do not tell their prescribing provider when they're experiencing sexual side effects. Instead, they just think, well, you know what, this isn't worth it, I'm just gonna get off this medication. And what's difficult is when you think about an antidepressant, the first 1 to 3 weeks is when you start really feeling those side effects, and you don't start to feel benefit until about 4 to 6 weeks. If it's low desire, you can change the dose of the antidepressant you're on. You can add an additional antidepressant that can kind of counter those side effects, maybe change to a different antidepressant. There's also one small research study that shows that just attempting sexual activity 3 times a week can actually increase your sense of desire. If this is a concern about arousal, one study has shown that exercise actually can increase sexual arousal. Exercising 3 times a week, a moderate amount of exercise, preferably right before sexual activity, can increase sexual arousal. If this is a concern with orgasm, we often recommend vibrators. We think about antidepressants putting kind of a wet blanket over orgasmic function, and that vibrator gives you that additional stimulation to kind of combat that wet blanket over your arousal function or your orgasm function.